Hi, this is Dr. Mohammed. Today my wife is having me do another video, and this is what I'm going to talk about today is cupping. Now, before we start talking about cupping, I'd like to tell you a little bit of story about my experience with cupping. I remember when I was a little boy, my mother, she would always have someone do cupping on her. Now, I'm a little boy, and I'm watching someone taking the glass cup, and this is the glass cup that we use in the office. But she would actually have someone take a glass drinking cup, put some fire underneath, and put the cup over her back. As a little boy watching this, I'm thinking, what is this? Now, if we fast forward a few years, I've learned cupping is very effective. So, thank you, Mom. So for this this is my first introduction to any type of healing that I've seen. I do chiropractic, I do acupuncture, I do cupping. But cupping, this is my first. There's several cups that I use in the office. This cup over here, this is really my favorite type of cupping, is using a glass cup. And what cupping does is it applies a negative pressure to your body. When if you come in and you have some sort of muscle ache, muscle pain, most of the treatment is we're applying positive pressure. That means I'm actually pushing on that muscle to help relax the muscle, applying some sort of force towards that muscle. With cupping, it's pretty much just the opposite. I'll take the cup, I'll cause a vacuum with the glass cup, I'll put some flame over here, it's going to burn up the oxygen, and I'm going to put it on the effective area. And it's going to cause a suction up towards the cup. And that is going to apply what we call negative pressure. So instead of putting pressure on there, the pressure is coming up. And this is probably one of the oldest healing arts. So this negative pressure relieves the pain. And it really works very well. And it feels really fantastic. I get this done on myself. I do it on my wife. I do it on my kids. I do it on my grandkids. And all of them love it. There's several types of cups I have. These are the glass cups. I require some sort of flame to suction it out. These cups over here, these are silicone cups. And even though these are my favorite cups, I generally walk around with a couple of these silicone cups with me. If I'm having any discomfort, I'll take it, I'll put it in an effective area, I push down, and it's right there. In the silicone cups, it's softer, it's easier. This is easier to go over body parts that's a little bit curved. I can take it and put it over there. So this is very versatile. It's very nice to have in my car when I'm traveling. So even though these are my favorite cups, this is what I walk around with. Another cup that we use beside the silicone cups is these plastic cups. These plastic cups, the way we draw the air out of there is we use this gun to suck the air out. So I essentially put it on the affected area, and I suck the air out, and here's the cup. All of these cups work. They all work very well. Sometimes I'll use different cups on different areas. Generally when I'm doing a treatment just for cupping, I'll use the glass cups and I'll put them on the back because it takes a little more time. But if I'm just doing one or two areas, I might use a silicone cup or the plastic cup. Another thing cupping is called by is by Hijama. And cupping or Hijama could either be done wet or it could be done dry. If you have any questions about this, please leave a message and I'll get back to you. This is Dr. Mohammed.